Work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408. Dr. Howard Dinner is the Director of Health Services at Community Health and Wellness Center, one of South Florida's most established natural healing facilities, serving South Florida with chiropractic, acupuncture, massage therapy, physical therapy, and auto and work injury rehabilitation since 1988. Dr. Howard and his staff have treated thousands of auto and work injury patients. They have extensive experience working with lawyers, and part of their process includes handling every detail of billing and insurance claims, auto accident insurance, PIP, and auto accident attorney liens accepted. Many times, you will not be billed for auto accident injury treatment until your case is settled. They also accept most insurance, including all auto insurance, all PPO plans, many HMO plans, and state and federal workers' compensation. Contact Community Health and Wellness Center today at 954-370-PAIN. That's 954-370-7246.
You are listening to the Ask the Expert Show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 6 p.m. Now, get ready for more Ask the Experts.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408. Dr. Howard Dinner is the Director of Health Services at Community Health and Wellness Center, one of South Florida's most established natural healing facilities, serving South Florida with chiropractic, acupuncture, massage therapy, physical therapy, and auto and work injury rehabilitation since 1988. Dr. Howard and his staff have treated thousands of auto and work injury patients. They have extensive experience working with lawyers, and part of their process includes handling every detail of billing and insurance claims, auto accident insurance, PIP, and auto accident attorney liens accepted. Many times, you will not be billed for auto accident injury treatment until your case is settled. They also accept most insurance, including all auto insurance, all PPO plans, many HMO plans, and state and federal workers' compensation. Contact Community Health and Wellness Center today at 954-370-PAIN. That's 954-370-7246.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 6 p.m. Now, get ready for more Ask the Experts.
And we are back. You know, I watch, well, I'm not going to tell you which news station I watch. I don't want to cause problems. But all the national people have all kinds of technical problems, and we have them once in a while. But we have our expert, Dr. Howard Dinner, and this was going to start off as just about a show about auto accident injuries, but Dr. Dinner is so easy to talk to and so easy to understand. We get into other areas besides just auto accidents. There's that pretty face.
Hey, how are you?
We're good.
It's been a month since I've spoken with you.
And then you got another show coming up this month too.
That's correct.
But first of all, I want to wish you a happy Hanukkah. And
thank you.
Same
to you.
We're really glad to have you, and your office setting is so perfect for this. So
thank you.
Let's get started. I want you, because we always have new listeners. I mean, I have 8 or 9 people I know today who are tuning into this show who've never tuned in before, but they wanted to hear this show. So, Dr. Dinner, and that is his name, Dr. Dinner. Tell everybody about your practice and your background.
Okay, we've been here in Plantation in the same location for 33 years now.
He's never gotten out of his seat. He sits there for 33 years.
I've been in the same seat for 33 years, the same office. The desk has been replaced, and so is the chair many times.
And you do change your clothes once in a while, right?
Oh, every day. We are a full natural healing center encompassing chiropractic, acupuncture, physical therapy, massage therapy, nutritional counseling, and other natural healing methods. We have seen thousands of patients, tens of thousands of patients over 33 years.
I've seen the files. He's exactly right. I've seen the files.
You're not supposed to have, but you must have
No,
come
not
in
what's in them, just the outside. I got caught one day. I was looking inside the files. But no, that you could tell you've seen a lot of patients over the years.
Yes, we have. And we're pretty conveniently located. We're almost smack in the middle of the county as far as if you plot us on a map. We have patients who come from Homestead, and we have patients who come as far as Orlando to see us, let alone the snowbirds who come down from the north every season. It's been good. And
you know what I have to ask you, Dr. Dinner, because you're considered an essential worker, isn't that right?
Correct.
So what are you going to do? What are you going to tell your patients about the taking the vaccine?
Personally, I will take the vaccine.
Okay.
I would recommend it also.
That's a good endorsement.
Right. I think it's our best shot to eradicate this virus and resume normal life in perhaps a year or so.
Well,
that's my
glad
opinion.
You said that.
Yeah.
Because I'm sure you're going to have some of your patients asking you that
Right.
if you would take it. And I want to get back also to your location. What's the hotel that's going up next to you?
No, the hotel is there, but we have a new mall, and it's called Plantation Walk.
Okay.
It was formerly the Fashion Mall, and the Fashion Mall, for whatever reason, was not as successful as a mall should be. But the This is a
Is it the
promising
Sheraton
development.
that you're next door
The
to?
Sheridan, yeah, the
Okay.
Sheridan, we're next door. They've been there from the very beginning, and
It's on
I'm,
University.
yeah, University Drive, and I believe they do very well, and or always have because of the national chain affiliation, and they will be here as an integral part of the new enterprise when it opens. There will be shops and there will be housing, and hopefully there'll be brand new restaurants
Well,
for
it's
everyone
so
to
easy to
patronize.
find.
Mhm.
You know, I had someone right before the show text me, and they wanted you to talk about because they had different areas of pain, not just low back pain,
No,
and
let me send it.
there's different ways that you treat people. You've got a lot of different treatment areas. The ones with the can't believe I'm lost with the pins. What is
Oh, that's
acupuncture?
acupuncture.
How
Right.
they wanted to know how successful acupuncture is.
It's very successful for a lot of conditions. It's very successful for back pain, neck pain, pain that radiates down the extremities, uh, sciatica, which is one of the pains that radiate down into the legs. It's highly successful for a whole variety of things. And the World Health Organization promotes acupuncture for almost any condition. And it's been around for, depending upon who says it, between 3 and 5,000 years, and developed in China, practiced in India and other and Japan and other parts of the world. It is the most practiced healing discipline in the world. And in other parts of the country, it is the first line of treatment, and Western medicine would be second.
So, what about if a person, this is a term we use a lot during your show, gets whiplash? Do you actually acupuncture in the neck?
Yes, acupuncture in the neck and other places, which are through meridian channels, which are energy channels. If we treat the energy channels, we can relieve the pain, and
How many
it's highly
sessions does it
successful.
usually take, Dr. Dinner?
Varies from patient to patient. That is the most difficult question to answer in all of healthcare. Some people respond in just a few sessions. Some people take a prolonged course of treatment. Um, it depends upon underlying conditions. It depends upon state of health, and depends upon how well somebody responds to the care. That goes for all the procedures that we do in our office, not only acupuncture, but chiropractic, physical therapy, massage therapy. We integrate what we feel is most beneficial for a patient when we treat them. Um, so a patient who comes to our office would receive multiple modalities, an integration of chiropractic and physical therapy with massage therapy, with um, acupuncture, nutritional counseling, um, to give the patient maximum benefit.
Well, we just got another tweet just now. For a person who's never been to a chiropractor, can you explain to me the difference in what you do and an orthopedic surgeon does?
Okay, initially, well, an orthopedic surgeon is their first method of treatment is medication. Their second method of treatment is perhaps surgery,
Surgery.
right, or physical therapy. Um, What a chiropractor does is evaluates a patient in a similar way that an orthopedic does. Depending upon the severity of the condition, usually some imaging is performed, such as X-rays or MRIs, to evaluate the seriousness of the patient's condition. Then we would proceed if we feel the patient would benefit from chiropractic, from acupuncture, physical therapy, and or massage therapy. Then we proceed after a patient has been thoroughly screened to make sure we're not dealing with other things which we wouldn't treat, such as infections, fractures, dislocations. Those we would refer a patient directly to an orthopedist.
We just
And
got,
also a serious herniation.
oh, so okay, we
that
just
would
got
go.
another tweet. I have so many questions for you, and people are tweeting us. They wanted to know: do you treat carpal tunnel syndrome?
Yes, we do.
You do.
And yeah, we do. And rather effectively with both adjustments, with manipulation, and with acupuncture. Carpal tunnel syndrome does exceptionally well with releasing the pressure on the tunnel. It's right there's a tunnel where the nerves pass through. It's a nerve compression um, condition, essentially, and many times we are very effective and prevent patients from having to have surgery.
Oh, that's wonderful. That is good. I never realized that you'd worked on carpal tunnel syndrome. What causes that?
It's nerve compression. It's the
Working
nerve
on a
gets entrapped.
keyboard, or is that as
You could get it from a keyboard. It is a more prevalent condition than it was perhaps 40 years ago. And I often tell people, these keyboards that we all use are not like the typewriters we once used. Okay, this is repetitive motion. When you're entering on the keyboard, it's repetitive motion. When you were going like this on a typewriter, as you remember,
yeah? I actually,
not,
I in my spare time, I fix people's typewriters.
right? Okay, so that was more like exercise,
Right.
right? This
Yeah.
is more like repetitive motion, and from the repetitive motion, there's a higher prevalence of carpal tunnel syndrome.
Well, we're going to go to break. Dr. Denver, give everybody your office number, especially with us getting so many texts in. What is your office phone number?
Right. 954-370-7246. And
Okay.
the way to remember 7246 is
Pain.
PAIN.
And
Right.
what days are you open Monday through Saturday, or
No, we're open Monday through Friday.
okay?
Okay, we have scheduled appointments Monday, Wednesday, and Friday. We see emergency patients on Tuesdays and Thursdays. We are always available. But
Those are the people that are
well,
bent over that come in your office.
correct. Okay, those are the patients who need immediate attention.
Right.
We accommodate them if they've had an auto accident, a fall, if they woke up and they just can't move. We have them come right in and we treat them.
Okay. We're going to go to break, and we'll be back with Dr. Howard Dinner. He's this. I would say it's not the senior part. He owns Community Health and Wellness Center. What a great place! I've been there several times, and actually, we're going to talk a little bit about that when we come back. We'll be right back.
Dr. Howard Dinner is the Director of Health Services at Community Health and Wellness Center, one of South Florida's most established natural healing facilities, serving South Florida with chiropractic, acupuncture, massage therapy, physical therapy, and auto and work injury rehabilitation since 1988. Dr. Howard and his staff have treated thousands of auto and work injury patients. They have extensive experience working with lawyers, and part of their process includes handling every detail of billing and insurance claims. Auto accident insurance, PIP, and auto accident attorney liens accepted. Many times, you will not be billed for auto accident injury treatment until your case is settled. They also accept most insurance, including all auto insurance, all PPO plans, many HMO plans, and state and federal workers' compensation. Contact Community Health and Wellness Center today at 954 370 PAIN. That's 954 370 7246.
Hey, and we are back. This is the Ask the Experts show. We're on every Monday and Thursday. This is a live show. This is not a podcast. It's a live show we do every Monday and Thursday from 6 to 7 with South Florida's finest physicians and lawyers and home improvement. We're here with Dr. Howard Dinner today of Community Health and Wellness Center. And, you know, we originally started the show talking about auto accidents. And how soon, Dr. Dinner, should somebody see you following an auto accident?
Well, they should see us rather soon, within the first few days following an accident. Sometimes they need to see us right away, depending upon how severe they are. But when the adrenaline starts to wear off, people sometimes start to feel more pain.
Yeah.
You know, the anxiety, the excitement, you know, the adrenaline, adrenaline rush that people have from being in a traumatic situation. And an auto accident is very traumatic.
Yes.
Even auto accidents which don't do a whole lot of damage to your vehicle.
That metal on metal, just, it's the worst sound there is.
It's the worst sound, the explosion. I mean, I've had a few myself.
Just in the last day or two.
No, not the last. I had an auto accident that I was involved in. I had a scratch on my bumper, really. And I really felt the impact.
Did you go to Community Health and Wellness Center? I heard they treat auto accidents really well. So, but it's a very scary feeling.
It was very traumatic. I have to tell you, it was extremely traumatic. The sound is so traumatic. And then a few days later, you start to feel a little achy. And I happen to, have the ability to almost self-treat myself. I receive adjustments from my associate, but and physical therapy from my staff. So I was able to essentially self-treat myself, or have my office treat me, and I was better within about a week or so. But I was pretty traumatized.
Yeah.
And just the sound. So anyway.
But they should get in right away.
And of course, they should get in right away. Absolutely. And the reason being, you don't know what kind of damage was done. You don't know if you're going to have any long-term effect. And you don't know what's going to happen if, like, a month from now, you decide, you put up with it long enough, and now you want to go for care. However, the legislature a few years ago threw all of us a curve, in that there's what's called the 14-day rule.
Yes.
In the state of Florida. And
you got to get in, or you're not
And you
going
got to
to
get
yeah,
evaluated. If you don't have your auto injuries evaluated within 14 days, auto your auto plan will not assume
right.
any responsibility. So we've had a few patients who have attempted, and the auto plans are very firm about it. It was a cost saving method, or it was, from their point of view, to assure that people who was hurt get treated, and those who are not don't come back, a month later saying it's a great idea, I should have gone. But you should go. Just get
Just
evaluated,
right.
just to get checked.
So what do you
Maybe
do? What do you
there's
do if
something
someone
wrong.
says, "Well, I'm not really having, I just had an auto accident. I'm not really feeling any pain, but something could come up 3 or 4 days later." What? How do you evaluate them if they don't really have any pain when they first come to see you?
Well, we'd evaluate their range of motion, their muscle spasms, their muscle tension, their symptoms. Pain is not the only symptom that could develop. You could have nausea, visual
Oh,
disturbances, um, have difficulty with what eating, with the tasting food. You could have gastric upset, chest pain, which you're unaware of where it's coming from, um, and the anxiety aspect of having sustained a trauma. So we would document a person as far as having sought medical care, and if the symptoms aren't severe, we would send them home and let them come back if something further happened. But they can come back at a later date. And I emphasize this because it it doesn't sound like, how could they possibly do something like that? It's one
right.
of those. How could they possibly do something like that? Right? Well, they did. So, but if you have been evaluated within 14 days and you come back a month later that I'm not feeling much better, I'm feeling worse, my neck is hurting much more, you can be treated.
Wow.
And because you initially got evaluated.
Well,
And
and
you
there's our
initially had
music.
a medical encounter.
Give Dr. Dinner a call at 954. What's the number?
370-7246. That spells pain. 370-PAIN.
And not only
And
do I endorse Dr. Dinner, he's become my pal. We've had some pretty long discussions, and he's just really
That
a
is
good
true.
guy. So, and he'll be back with us next month, but actually he's going to be back with us again this month. I'll let you know the date. And Dr. Dinner, it's always good seeing you.
Thank you, and same here. You're looking great, by the way.
Okay, don't butter me up. I love this guy. Thank you, Dr. Dinner. And we'll see you again on Monday at 6 o'clock for more Ask the Experts.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.